Welcome back to the Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McRae.
Faster and cheaper genetic testing is helping change the way we treat and prevent cancer. Gathering genetic information can help patients receive treatment that is better tailored to their disease, thereby making it more effective.
Cancer patients can also find out if they have a hereditary trait that could be passed on to children or grandchildren, giving parents and families a leg up on preventing hereditary cancers. Joining us on the phone to discuss genetic testing is Dr. Douglas Riegert, who leads the Hereditary Cancer Clinic on Mayo Clinic's Florida campus. Good morning, Dr. Riegert. Welcome to the program.
Good morning. Thank you for having me.
Dr. Riegert, just going back how this all developed, with all the environmental factors that cause cancer, for example, smoking, how did this program come about genetic testing for cancers?
This program came about because it was found that some families had a very high rate of cancer at a very young age that wasn't explained by environmental factors.
What types of cancer? Are there specific types of cancer that are hereditary, like a lymphoma or?
I would say at this point we've found hereditary cancers of every type, ranging from lymphoma to melanoma, colon cancer, and breast cancer. The common, or one of the most common in the earliest described form of hereditary cancer, was hereditary colon cancer.
Why is it that I'm not the doctor here, so why is it that some cancers are more likely to be a hereditary type than others?
Some cancers are primarily caused by environmental toxins. Could be melanoma from UV radiation, could be lung cancer from smoking, mesothelioma from asbestos. Other cancers are kept in check by genes which prevent cancers from forming. And when those genes are broken, patients, due to hereditary traits, patients are at increased risk for cancer.
You reeled off a number of cancers a minute ago. Are there ones in particular that have a stronger preponderance in terms of genetic background?
Yes, I would say it would on one end of the spectrum would be breast and ovarian cancer. Approximately 10% of people at breast or ovarian cancer have a hereditary component. Then there would be a middle ground with colon cancer and other cancers, about 5%. And then on the other end of the spectrum, where there's a low but still positive incidence of hereditary traits, would be melanoma and a few other cancers.
You had said just a moment ago that there are genes that prevent cancers from forming. So people that get cancer maybe don't have that gene, or something has happened to that gene. Is that more often what's happening, genes that prevent the cancer from forming? Or like you just said, there's some that do have, that could lead to cancer. Which happens more often?
The most often event would be a genes that suppress cancer, or tumor suppressor genes, are broken. On the other end of the spectrum, there are less common syndromes where there are genes that are activated, and those are cancer genes or oncogenes.
That's amazing.
It is. So, Dr. Riegert, can you just then describe what is your protocol for testing? For example, do you screen for everybody, or do you look for a family history? How do you determine which patients are applicable for this genetic testing?
So, there are many issues involved with genetic testing. People are concerned about inheritance patterns. They're concerned about genetic discrimination. They're concerned about cost. That's not as much factor as it was. So patients come to the clinic. We're non-directive, take a personal and very comprehensive, drawn-out family tree history, and then we tell them what tests are available, what their odds of having a positive test are, and what the value of the testing to them would be. And then patients decide whether they want to have testing or not. The uptake on testing in the clinic is about probably 70%. So 30% of people opt for testing. 30% of people don't want to have testing, and about 70% do at this point.
This has come a long way really fast in 5 or 10 years. And I remember the first time that I heard about this even being part of a conversation, it was, we don't know how much patients want to know or should know, or how much they can handle. And I know that genetic counselors are part of that as well. I would have to imagine that you're working with them too.
Absolutely. We have 2 genetic counselors here at Mayo Clinic, Florida. Going back to your other point, I would say 2 key developments have led to increased genetic testing for hereditary cancer traits. The first would be something the Mayo Clinic was a part of. We can be proud of at the Mayo Clinic, and that is, in the past, the patent office had allowed people to patent genetic information. And so someone would patent a gene, and then they would have monopoly on it. So they would say, if you want to test this gene, you have to pay me X amount of dollars. Or you can't test this gene. I won't allow you to. I've sold the rights to someone else. The Mayo Clinic and a group of geneticists sued one of the companies that had one of these patents and took the case all the way to the Supreme Court. And the Supreme Court invalidated patents on genetic testing.
Wow.
The second development was that 2 different companies invented new technology, which is much less expensive to do genetic testing. So within a year, costs for hereditary breast cancer dropped from around $3,200 to $1,000.
Wow.
Another advent has been on the non-technical end, the non-cost end would be, in the past, people were primarily being tested for knowing their own risk and then their children's risk. It didn't change their immediate cancer treatment, but for both breast and ovarian and now colon, if you have one of these hereditary traits, you receive a different, more effective chemotherapy than if you didn't. So it changes your personal treatment, not only your understanding of your cancer risk and your children's cancer risk. And all of those factors have come together to really form a nexus for increasing testing.
You just mentioned what my next question was going to be, and that has to do with the treatment. So understanding that genetics can change the treatment for breast cancer or something of that like. What about preventing further cancer? Does it help in that area as well?
Yes, it does. I'll give you an example from hereditary breast cancer. So a study from England showed that if women have hereditary breast cancer and they simply have a lumpectomy or partial breast removal, and then it compared them to women who went and had prophylactic mastectomies on both sides when they had the cancer diagnosis. They compared the survival between the patients with limited surgery and those with more extensive surgery 20 years later. The survival rate of the women having more extensive surgery was 60%. The survival rate of women having the limited surgery, leaving more breast tissue to form cancer, was 40%. There's a 20% difference in the long-term survival. So it definitely informs risk. Most women in the United States will, if not now, or I would say now, have testing for hereditary traits even prior to surgery to help guide treatment.
Now, Dr. Riegert, we're talking about the patient, but how do you deal with the family? For example, if the patient has a hereditary cancer, how do you speak to family members about them potentially undergoing testing?
As you know, it's important to treat every patient as their own individual patient. Mm-hmm. So first thing we do is we let family members know they should tell other family members. Then when other family members contact us, we see them, as their own individual patient with other family members if they'd like or not, and give them their own counseling session. Interestingly enough, when people have a relative diagnosed with one of these cancer syndromes, and they are told that they're at a 1 in 2 or 50% chance, like they usually would be, the uptake rate on testing is actually less than what I told you initially. It's actually 50% or less. It's very variable how much value people see in the testing based on their own personal experiences and situation.
Why do you think that is?
I think first off, one thing that comes to mind is the insurance. So some people say, I could afford the cost of test, but if I have a positive test result, I need to have yearly MRIs or of the breast, and I can't afford that. I don't have health insurance. Second group of people say, you may say the risk is 50% that I'll have breast cancer, but I'm seeing that as, good odds. That's 50% I won't have breast cancer.
Right.
So, another group of people a smaller group of people are people who are concerned about genetic testing. There are people who feel genetic testing somehow invades their privacy. They don't want to be labeled. Mm-hmm. And people oftentimes, now doing this here in Florida for 10 years, I've found that people change their minds. People who made one decision 5 years ago, not infrequently they come back to the office to make a different decision.
We have 30 seconds left. Can you tell me what's next in the field of genetics or hereditary cancers?
The next big thing would be that everyone will be offered hereditary cancer testing at a very low price. Directly to consumer. There are companies that have already formed to that, and they're already in motion to offer direct-to-consumer hereditary cancer testing.
Wow. We've been discussing hereditary cancers with Dr. Douglas Riegert, who leads the Hereditary Cancer Clinic on Mayo Clinic's Florida campus. Thanks so much for joining us, Dr. Riegert.
Thank you for having me.